Orientation Radio of the Foundation for Character Reformation and Integration in Nigeria, FOCRIN, a non-governmental civil society organization established on the 21st of March 2003 to promote and sustain social enlightenment of good character, attitudinal change, transparent democracy, and living in peaceful harmony, presents Changing Orientation, inspiring Nigerians to cultivating orientation. See and hear what Mr. Andrew Ajayi, the radio senator, is saying here.
Good greetings, everyone. The African Nigerian must see and hear this. A character reformation mobilization on health matters entitled Healthcare System in My Country in the New World Order. When you are sick today and future, a wake-up call. Even though I have been thinking the coronavirus pandemic, COVID-19, got me thinking more. Please follow the message with patience. It is God Almighty speaking through me as the giver of inspiration. All other African countries that are lagging behind in good health care system for their citizens could be inspired or take motivation from this as well. May I ask this question? What do you think is hindering us from attaining the new order in healthcare provision for citizens of Nigeria in Nigeria? The answer, among many others that people would give, could be bewitchment by negative satanic forces of corruption. Partly so, maybe, but obviously, I think it is lack of positive vision of identifying what we really want to do for ourselves on healthcare matters, coupled with great leadership foolishness, which is occasioned by citizens' nonsensicalities of being docile, not knowing their left from their right, wrapped up or enclave in the attitude of what I call ino-consignism, and leave them for God, and God will judge them. This is because if a people know what they want and how to get it, that people will never be corrupted by the insensitivity of selfishness, outright stealing tendencies and greed, misappropriation of funds, and inflation of cost of contracts for delivering health care equipments and infrastructures. With this type of behavioral pattern, the money that will be geared towards achieving an amazing healthcare system can never be enough. Hope the exposition is clear. Over the years, since political independence of the country, we have suffered the non-availability of a proper healthcare delivery system in our society. This is the time for Nigeria to have a system of healthcare that makes everyone or any citizen to choose to be treated in Nigeria instead of anywhere else when he or she falls sick. This is the envisioning we must first identify in order to catch the bug of resolution to work it out. This is because a situation where our government officials embarrassingly inform us that our healthcare delivery situation in the country is that bad tells you a lot. Even worse still, people who lobbied, begged those who begged citizens to vote for them as presidents, governors, and local government chairmen to be appointed to man one office or the other in government. For example, health, among other ministries, would turn around to be telling the citizens that it is not easy to do these things when journalists point out their ineptitude in that same office they begged to occupy. Why then were they appointed in the first place? Why were they appointed in the first place? To give excuses, right? No. We must become a people who takes care and can take care of themselves at any given health challenges, be it small or magnitude proportion, now or in the future. The Europeans, Americans, and Asians knew the importance of proper health care. That is why they invested in it in such a manner that make people, including Nigerians, to be rushing to them for treatment whenever they are sick. If not, why do we black Nigerian people take the next available flights to the earlier mentioned continents to treat ordinary mosquito bites and any other ailments, or to carry out surgeries? Is it that we do not know the significance of having our own functional healthcare system for ourselves and by ourselves? How many Nigerians have died inside the aeroplane while traveling? How many Nigerians have died inside the aeroplane while trying to get health care abroad? Also, how many people have died on hospital beds only to be brought back to Nigeria for burials? This should come to an end if we build our own homegrown healthcare system delivery that includes a comprehensive laboratory research breakthrough that now enables us to discover and produce, manufacture vaccines, medicines, and drugs in our homeland. For a nation to have a near-perfect healthcare delivery systems, it must deliberately put investments in the production of vaccines and medicine by laying steps to encourage individuals, groups, and government itself to go into the establishment of a world-class infrastructure science laboratory technology for research and provide the enabling funding requirements so that we stop the importation of drugs and healthcare-related equipments. Sequel to this, our focus should now be on total drug manufacturing in our nation so that we develop capacities for a world brand hub of vaccines and medicine production for our healthcare needs, the way other sensible countries are doing beautifully. Oh yes, beautifully. We should never and don't have to wait for the Western and Asian governments and the likes of Bill Gates of America, Jack Ma of China, and any other person in the world donating equipment and drugs to us before we can deliver health care and protection to ourselves. The way we are terribly challenged now, and possibly this same way in the future, with yet another more deadly pandemic, epidemic, and pandemic put together. What would we then do in order to prevent us from running helter-skelter? Hence, who as individuals, groups, or government agencies is carrying out a proactive research for possible solution in readiness to nip such large-scale dangerous diseases in the bud and treatment the way the Asians, Europeans, and Americans are doing quickly and will do in advance? I have not seen any. Needless is it to start counting the statistical figures of the total number of both very old, most recent, and newly established private and government institutions for the learning and research in these interest areas of pharmacy, drugs, and herbal medicine remedies to ailments, because they are very many institutions indeed. What are the senior alma maters of those institutions doing about this? What are they doing about this? Where are they? They should have a wider orientation of patriotism beyond reading those subjects for their selfish survival. This is why I am speaking like this today. And let us get out of the inferiority complex of waiting for the Westerner, of waiting for the Western or outside world generally before we can do anything. Let us put on the spirit thinking of true independence. Wake up, my people of Nigeria. Furthermore, make no mistakes. To build beautiful hospitals or hospital structures is necessary, but not sufficient at all. As this is not the healthcare in itself, but only part of it. Other important components of good healthcare delivery system is the availability of a balanced psychological, mental well-being of healthcare professionals that must be ready to work in commitment. Yes, dedication as a result of love for their job and for their country, Nigeria. Our healthcare workers threaten Nigerians with and embark on strike, leaving fellow citizens who are sick and on admission in the hospital to die needlessly and untimely. As modern and up-to-date state-of-the-art medical equipment that could be locally manufactured for the diagnosis and treatment of people is what constitutes a good healthcare system of a nation state. How many presidents, governors, and local government area, county chairmen of the Western world, European and American countries do you see other than Nigeria's, Africa's, traveling up and down, seeking for health care outside their homeland? How many have you seen coming to Nigeria for health care, for instance? And why shouldn't it be so? But Nigerians travel out to abroad all the time after pulling or stealing our common wealth for treatment when they fall sick. What then is the fate and hope of those who cannot pull such required money, either by legitimate or crooked means together? Please answer that question, ladies and gentlemen, as you watch and listen to us today. Of course, they die. Yes, they die because they don't have such money to help themselves to get treatments in foreign lands. But I say no. I say no. This should no longer be the case. Everyone must live, and when sick, must get the right health care that enables such a person to bounce back to reinvigorated and sound life that enables them to contribute in their various endeavors in nation building. This new other healthcare system must not be too expensive, exploitative in all ramifications, but it must be very cheap, because we don't have to spend or pay all the money we have in our bank account before we can be well from sickness. It is an absolute truth that we must be healthy to be able to contribute to nation building. This is a clarion call to all and sundry, especially the whole healthcare professional bodies in Nigeria, to optimize us in this new healthcare system that I talk or philosophize about. Although it is in human nature to be sick and even die via sickness, but thank God Almighty for our health scientists and professionals who He gave the opportunities to be so, to do their job of health care from all manner of ailments, which they should start to do in line with the new consciousness to attain the new order. However, the political class should make the economy a good one where our naira currency is no longer weak, so that whatever people earn, irrespective of their professions, should take them home. Indeed, at a time of a global and national health challenge of the coronavirus, COVID-19 pandemic, we became exposed that as a nation, we are not able to produce a common nose mask, hand gloves, not to talk of ventilators for her citizens, and have to beggarly rely on the foreign lands. If those foreign lands did not produce for themselves, how would we get to help our people out of this? So you can see our emptiness as a country since 1960 of political administrative leadership opportunities where plenty money are involved. Wasted, you would say. Improper focus, embezzlement, and general official corruption in the health sector has left many people who ought to be alive today dead. But even though everyone dies sooner or later, a concerted and deliberate effort to provide a unique healthcare system that saves lives is always a great advantage to the people in a country that has such. At this stage, fellow citizens, the attitudinal or behavioral pattern of a good number of healthcare workers and caregivers to a large extent requires reformation if they must continue to give support and sustenance of people's health. Among many other things we could say of the unprofessional conduct of our health caregivers and personnel, that time will not permit me to expose here, is the alleged running away in Lagos Gbagada Hospital upon sighting a patient that was sneezing when entering the hospital, and we were told they ran away shouting, "Coronavirus is not my portion." Where is the exhibition of various professional oaths that they swore to upon their graduation in the various institutions of learning and training they attended? To be savers of lives of the people, could it be bread and butter healthcare professionals we have in Nigeria, only interested on how to make money from patients and government? Since there is global politics for who is supreme and strongest in almost everything going on in the world, should we be running to those who may want to manipulate or exploit us as individuals, as individual nation, if we are greatly challenged health-wise? This is the echoes of a failed or non-existent healthcare system that must become a giant. You see, as a nation of growing population, which is natural, let us build super public hospitals with modern equipments in the 774 local government areas of our 36 states in Nigeria, to contain any anticipatory large number of patients of whatever intensity and spreading capabilities a disease or virus may have. With the required training and retraining of health care personnel, with a rekindled group, individual and government health focus priorities of funding as a people, this will help us to become self-sufficient in our health care delivery system as a country. A situation worse than the coronavirus pandemic, whereby circumstances of things leaves no room for anyone to escape out of their countries, because everywhere is locked down, as we saw in year 2020, may surface again among people of the world. What then are we to do? What are we to do? Or are we waiting for the United Nations World Health Organization to build and hand over a healthcare system for us? Home is home, and homelands is usually laid with the finest of everything. Our brothers and sisters who have seen good healthcare system where they have lived and worked in foreign countries must, out of good conscience of patriotism, join with all means possible in this reformation of a new order in our healthcare system. No matter your status in the society, whether high and mighty, low and powerless, rich or poor, when you have health challenge and cannot get the right, proper and adequate care, you will die. Therefore, you have an obligation to ensure that the reality of a functional and reliable healthcare system that guarantees a quick return to healthiness from sickness by anyone today and future in our nation is delivered. Please join the visionary advocacy train by sharing this message video to other various social media platforms for everyone to see and hear, so that our governmental executives become aware for quick action to start. This clarion call and more well outlined, unique strategic thinking to achieve it, I offer as additional philosophical burden and attempt to build our nation. It is my hope we are ready. Thank you. Thank you. See you in the new order of healthcare system in our nation. God bless you for taking out time to listen and watch this message. God bless Nigeria. And let me say, hashtag, start to build the new order healthcare system for citizens. Hashtag, no political office holders should travel out of the country for healthcare. Hashtag, people who want to occupy governmental offices must be competent in those offices without giving one excuses or the other why they are failing the citizens' expectations. If so, they should quickly resign. Thank you again. Yours patriotically. My name is Mr. Andrew Ajayi, the Philosopher Radio Senator, lead advocate, Foundation for Character Reformation and Integration in Nigeria. Since 2003, we have been talking about character reformation in the country. I am also a development and peace expert, a public affairs commentator of many years standing. Well, in case you require a further interaction with me, you could call me on 0803 614 8980. My Twitter handle is at the Radio Senator. One word, at the Radio Senator. My Facebook page is simply Andrew Ajayi. It's a page because the first one is already filled up with my lovely friends. So just search for Andrew Ajayi and like the page. You can also be connecting with me on YouTube. Simply go to YouTube and look for Andrew Ajayi. Like and subscribe the page. Thank you and God bless.
So, Mr. Andrew, I've listened and I've seen your heartfelt devotion on this. So I want to know for real what has actually propelled you into putting all of this together.
Thank you very much. You see, it is out of passion for our nation and the people in the nation. When we compare ourselves, to what is happening around us in terms of, proper healthcare system, you see that Nigeria, we are really lagging behind. A lot of people die in the hospital. Look at now that coronavirus came, we started running helter-skelter, we started building makeshift tents and what have you. Ordinarily, all those structures should be in place, okay? Should be in place. And our government, for God's sake, should, at the various levels that they operate at government, be it federal, state, and local government, they should devote huge resources to our collective healthcare. It's not that because some persons are privileged to have access to, the country's money because they are in political power, they will be taking the next available aeroplane to fly out of the country to go and cater for themselves. thereby leaving majority of Nigerians to suffer. And does it beat your imagination as a people that in most cases when our doctors and healthcare workers go on strike, that many loved ones die in the hospital? These are the motivation I actually have to say we can do, do a thing for ourselves by giving ourselves a proper healthcare situation. Look at all the medicine, drugs we consume as a very large people of over 200 million people in the country. For instance, these drugs are not manufactured in Nigeria, yet we have so many youth who cannot work and they read health-related, medical, laboratory science, herbal production, whatever. So I'm thinking that if this contribution of mine falls into the positive ears of all well-meaning citizens, even in future, those who will read healthcare related courses and government officials, they can work to make sure Nigeria has that proper healthcare system that will make all of us happy. Never to travel outside of this country. Yes, we can. God bless Nigeria.